Hi everyone, welcome back to the Dr. Sia channel. In the video here today, we're going to be talking about what can you start doing today, right now, if you have an ambivalent attachment. Let's get started. So what can you do if you have an ambivalent attachment? Now, the number one thing that my patients, my experience tells me is start searching for your genuine, true wants. Now, I know that sounds like, what is this guy on about? Let me just say that again. Start searching for your personal, genuine, true wants. That's what you can do. When you have an ambivalent attachment, you don't have genuine wants. What you have are shoulds. What you have are ought tos. What you have are I hopes. What you have are ideas that if you can be in a particular way, have a particular life, have the fence, have a house, have a particular partner, have a particular pet, have a particular job, have a particular experience, be a particular person, be a particular way, that these things are going to eventually result in all of that yucky, mucky anxiety and doubt go away, and you will be rewarded by the same system that somehow created you, meaning that you have in essence forsaken your genuine wants in return for what is largely a self-sacrificial life of trying to attain what you have been told that you should attain, and that you will be rewarded when you attain those things. And of course, what you will find, what a lot of my patients find, is that the reward just does not come. That you try and you try and you try, but you're always looking for that next thing, the reward that finally, daddy comes and says, now you are perfect, now you are good, now you can feel good within yourself for the rest of your life. That never really happens. So what can we do about that? Well, you can start looking for your own genuine wants instead. And that means you start thinking about what you want in life with no barriers. No barriers. Just start imagining right now. For example, I want to be a millionaire. Okay, just write that. I want to be a millionaire. And then once you've done that, then you can think, okay, but can I be a millionaire? Wait a second. No. No chance. This guy never going to be a millionaire. So what you can then think about is do that same thing. For example, you might say, I want to come out. I want to come out, says one of my patients, right? One of my patients says, I want to come out and I want everyone to know that I am lesbian. So, okay, now can you, right? Now, if you think that this is an easy thing, my patient was sitting there, we were working on this for almost 3 months for her to acknowledge that this is what she wants, that she wants to come out as a lesbian, that she wants to come out and say that she is this. She couldn't even form the sentence, right? Trying to form that sentence became, but people shouldn't really bother anybody. Like what she wants to say is, I want to come out as being a lesbian, and midway through the session, midway through that sentence, what comes out instead is, people shouldn't bother anybody, should they? So you can see how much for the ambivalent attachment, wants, desires, what's inside gets replaced by shoulds, cannots, have-nots, inabilities. Another one of my patients with ambivalent attachment says, look, what's the point in saying what I want? I mean, it's not like I can go and travel the world anyway. Like, it's not like I can just go and be like, just one of these explorers. Like, I can't just be that. I mean, I have responsibilities. What's the point in saying what I want? So you can hear what she's saying that she wants. What she wants is to be an explorer and travel the world. But she just can't say that. She can only say, what's the point in saying that, right? So then I kind of help her. I kind of go, let's try to look at, if we just don't look at those shoulds, if we just don't look at what's possible and what's not possible, and what you can do and what you can't do, what do you want, what do you want, what do you want? And we keep working on that for 5-6 sessions on end. What do you want? And finally she says, I want to be an explorer. I want to travel the world. That's what I want. And I can't do that. I've never been allowed to do those things. I've never been allowed to be who I want to be. And then she starts getting furious mid sentence, right? Mid kind of explaining that. She kind of exclaims then, they never let me be who I want to be. And now we start seeing some part of you awaken. When you have an ambivalent attachment, you need to awaken that part of you that's connected to want. You need to unshackle yourself from all of the expectations that have been set upon you, put upon you. So start pursuing your want today. And that means, takes me to my second point, and I only have 2 points for this video. The second point is start upsetting some people. I know, it's hard. It's hard. When you live a life that you pursue, that you are trying to actualize you are trying to fulfill your potential, you are trying to live a life where you actually enjoy yourself, you will step on some toes. I have stepped on some toes. My friends have stepped on some toes. My partners have stepped on some toes. My colleagues have stepped on some toes. You cannot, and no one ever has lived a completely fulfilled life driven by wants and actualization without stepping on some toes and without displeasing some people. Some people are going to have to be displeased. Your mom, your dad, their perception of you might have to change. Your family's perception of you as the golden child who will always be there for everybody and does everything for everyone might have to change. So do what you want and start getting ready to upset, hurt, and disappoint a lot of people, if not a few people at least. So those are the 2 things. Pursue your wants, start upsetting people. I know that sounds strange, but if you have an ambivalent attachment and you know that, you know exactly what I'm talking about. You know that this makes a lot of sense for you, and that's what this is about. Anyway, I hope you enjoyed the video. I hope you press that like button. If you did, when you press that like button, what happens is that there's this YouTube algorithm. It actually makes this video more visible to other people. So if you're one of the people who is watching my videos like 100 times over, has watched every single one of my videos or whatever, please press the like button. Like, it's actually really important, because the video that's watched 1,000 times but never liked goes way to the bottom of YouTube. But if you press that like button, it goes up to, like, you know, a video that's been watched 1,000 times and liked 1,000 times is much more likely to be visible to other people. And what we're trying to do here is to bring this information to a lot of other people. So if you're a psychologist or something watching this, or just the average person, you want another person to see this video, press the like button. Thank you very much. I'll see you next time.